Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question asks if I can discuss the effects of exposure to borderline personality disorder. I'll refer to this disorder as BPD. So this question is really talking about the effects on the partner of somebody with BPD as opposed to the effects of the disorder on the person who has it. So I'll answer this question by looking at the 10 signs of BPD exposure. In this video, I'll be focusing on romantic relationships here as the context. I'll refer to the partner of somebody with BPD, so talking about a romantic partner. BPD exposure, of course, can affect other people, like parents, children, siblings, and friends, but the most common victims of BPD exposure are romantic partners. Before I get too far into this topic, it's important to note that borderline personality disorder can lead to a lot of suffering, and it often does. It also leads to dysfunction and frustration. The person with the disorder often suffers tremendously, especially if the symptoms are severe. And that, of course, doesn't mean that we should dismiss the suffering of the partners of individuals who have BPD, but rather it's important to keep in mind that everyone is suffering when borderline personality disorder is involved. As I go through the signs of BPD exposure, I will be using the example of a female with BPD and a romantic partner who is male. There are two main reasons I configured this video in this way. First, much of the research literature is actually focused on this particular dynamic. Second, using he and she is more expedient, clear, and precise than using the word they. Many of these examples, of course, would continue to be valid with other gender combinations. Now let's get started with the 10 signs of borderline exposure. Sign number 1, the partner is unsure how his behavior connects to what happens in the relationship. So what do I mean by this? With BPD, we see an unstable relationship pattern. The person with BPD tends to alternate between idealizing and devaluing her partner. This love-hate cycle is not necessarily connected to anything that the partner does. So he ends up not knowing how his behavior fits in with relationship outcomes. He doesn't understand the effect because it's not actually connected necessarily to her behavior. In a sense, there's this idea that the anger, the arguments, the conflict are all random. No matter what the partner does, he can't affect the outcome. He can't improve the relationship. He can't fix things. And he can't repair damage. In a sense, it comes down to a feeling of powerlessness. Moving on to sign number 2. This is having feelings of shame and guilt. This really fits in well with the first sign because the partner is unsure about why the borderline behavior is happening. And he may start to believe that he is responsible for the symptoms. He may ask himself, did I cause this? Other questions he may ask himself, am I good enough? Am I loving enough to make this relationship work? And am I missing something? And I've seen this really discussed in two senses. When somebody says, I'm missing something, they could be talking about not seeing an explanation for the behavior, like, am I looking at this person and just not seeing something I should be seeing? The other sense would be some characteristic that I should have that I don't, that makes me a poor partner. Moving on to sign number 3, this one is paranoia and hypervigilance. Now this is interesting because paranoia is actually a symptom of borderline personality disorder, and hypervigilance is a symptom of post-traumatic stress disorder. I think we see these symptoms because the partner can be randomly attacked for seemingly no reason, at least not a reason that he's aware of. He worries about when the next anger outburst is coming. Really, it's similar to the first sign. It really comes down to powerlessness. He doesn't have control over what's going to happen next. He can't figure out what to do to stop the anger and aggression. Sign number 4, the partner may draw the disdain of friends and relatives. With BPD, it's not unusual to see behavior consistent with vulnerable narcissism. For example, we see shame, hypersensitivity to criticism, resentfulness, and distrust. Along with those characteristics comes this idea of playing the victim. With BPD, we see a lack of ownership. We don't see somebody taking responsibility for their actions, but rather framing every situation as them being the victim. As the individual with BPD talks to her friends and relatives, she tends to shift the blame for her negative emotions over to her partner. Those people might believe that the partner is responsible for what's going on or that he is too sensitive. He may hear a variety of questions from friends and family members. Some examples: why are you so upset at her? Because she's being mean to you? So this is really kind of like minimizing, like you shouldn't be upset just because somebody else is a little bit mean or has a little bit of anger. Next question: if she really attacked you, why didn't you fight back? So this is really just not understanding how things really work in relationships involving BPD. People sometimes tend to believe that combat can somehow solve the problem. Among the many reasons why the partner won't fight back would be the fact that much of the time, when there's a fight between romantic partners, both people end up getting arrested if the police are called. Also, the partner knows the tendency of playing the victim that we see with borderline. The partner worries that he's going to be falsely accused of being the aggressor. We know from the research literature that a woman with borderline personality disorder who attacks her partner is often injured in that process. So again, the partner is just kind of doing the math here. He realizes if there's going to be some sort of physical altercation and the individual with BPD is going to be injured as part of that altercation, he may very well get blamed, right? So this is just him being defensive, him trying to protect his own interest in terms of the legal consequences. So asking why didn't you fight back is really just simplifying this matter to a great extent. Another question he might hear: why don't you just leave if it's really that bad? Or why didn't you leave if it was that bad? Again, kind of treating the relationship as if it's extremely casual and there's no investment. This one's really being particularly flippant. And the last question he may hear from friends and relatives would be, what did you do to make her that way? So squarely shifting the blame onto the partner. Sometimes friends and relatives figure out what's going on, especially if the borderline behaviors are extreme and they tend to happen over a long period of time. So people see the pattern eventually. So there may be some relief for the partner in terms of this particular sign as time goes on. Sign number 5 is a fear of abandonment. Now this, of course, is ironic because this is one of the symptom criteria for BPD, but this fear can also be experienced by the partner. This unstable relationship leaves the partner wondering if he's going to be rejected, if he's going to be alone at some point because of this. It can also lead him to not want to invest a lot of energy in the relationship because it may be destined to fail. Moving to sign number 6, this is depression. And I think one reason this could happen is because the partner asks himself, will things ever change? There comes this sense of hopelessness in these types of relationships. He may also ask himself, where have all my friends gone? Right? A lot of the friends of this couple don't want to deal with the couple. So the partner becomes isolated. And again, this is connected to depression. The partner also has a number of unmet needs, including emotional needs. In a sense, he's suffering from emotional starvation. He's unable to connect at a deep level with the individual with BPD, and this can be a struggle. Sign number 7 is the partner becomes familiar with the legal and mental health system. Because of the many interactions with law enforcement and mental health providers, the partner becomes familiar with navigating the system. He becomes well known to authorities and treatment professionals. In a sense, this can be a good thing for the partner, as it can result in him being connected with services. So if he ever needs to leave that relationship, he can understand these two systems, and this might be helpful in helping him to get out of the relationship safely. Sign number 8. The partner may feel reluctant to advocate for himself and or reluctant to seek support. Why does this happen? I think there are a few reasons for this, but one that really stands out to me is the concept of unequal damage. So I'll illustrate this through a couple of analogies. Imagine sitting in an uncomfortable chair in a hospital room visiting someone who is recovering from surgery. The fact that that person you are visiting is recovering from surgery doesn't make the chair any more comfortable, but complaining about how the chair makes you feel doesn't seem equitable. It doesn't seem polite in that context because, again, you're there with somebody who is suffering more. Another analogy, I remember some time ago, one of my neighbors accidentally drove into my old full-size pickup truck that I have in my driveway. The bumper of the truck had some gashes and there was some paint transfer, but her car was significantly more damaged. It sustained a lot of damage to the hood and grille. So it was my neighbor, so of course I didn't worry about it. But even if it were a stranger, that unequal level of damage would have probably led me just to not worry about it, right? It's an old truck. Old trucks get banged up. And with her car really having all that damage, it just felt like complaining, again, wouldn't be polite. Sometimes it's more socially appropriate just to let things like that go. That doesn't mean my truck wasn't actually damaged. Again, it's just comparing it to the other damage that makes it seem like it's a better idea not to worry about it. So moving back to the situation with borderline, I think this is what's happening some of the time. The partner just feels guilty about pointing out the suffering that he's experiencing in light of the greater and more obvious suffering of his partner who has borderline personality disorder. Now moving to sign number 9. This is the partner having a backup plan in terms of living arrangements. Relationships involving one person with BPD are characterized by frequent breakups and reconciliations. So the partner creates a backup plan so that he can continue to function in other areas of his life when the couple is separated, right? So this is just a product of learning. He sees the pattern and he makes adjustments so that he's less inconvenienced when these breakups occur. This often takes the form of having an arrangement with a friend, right? So the partner has a friend and that friend knows that the partner may need to live at that friend's place on short notice. So it's just a matter of creating backup plans and letting people know that one's relationship is unstable, right? People become aware of that and some of them are willing to help and the partner has to take advantage of this help once in a while. Moving to sign number 10. This is the expectation or the concern of a sudden and violent death, right? This one seems morbid, but I've seen this many times. And as is the case with many of these examples, this actually applies, of course, to any gender combination. The partner of an individual with BPD, although statistically unlikely to die from homicide, is still at an increased risk and is often aware of that danger. I think much of the time this is more a product of frustration and depression as opposed to actually believing that they're going to be murdered by their partners. But it is still something that I hear regularly, and it is supported by the research literature, meaning there is a cause for concern in these types of situations. Violence can lead to a lot of negative outcomes, including death. I think this underscores the importance of considering all appropriate options in a relationship like this, such as ending the relationship. Relationships involving borderline can be enduring, and in some cases can be satisfactory, but clearly there are real risks which need to be thoughtfully considered. As much as couples want to work things out, some relationships just aren't meant to be. Another interesting point with this last sign is sometimes I see that people really aren't necessarily distressed about this expectation, right? So it's not really the concern part as much as the expectation. They believe that someday things will work out badly for them, but they're not necessarily worried about it. Almost like they've just accepted that that's the way that things are going to be, right? Which is kind of a sad position to be in a relationship so violent, so filled with aggression and anger, that a partner looks at it and says, yeah, things are going to end up badly for me someday, but I'm not that worried about it. I just know it's what's going to happen, right? I just have to be a realist. So again, when thinking about that type of outcome, if there's really an expectation of that, that has to be worrisome. That's a good time to reach out for help, counseling, and other types of help to support the partner and the individual with BPD to keep that relationship safe. So I know whenever I talk about topics like borderline personality disorder, there will be a variety of opinions. Please put any opinions and thoughts in the comment section. They always generate an interesting dialogue. As always, I hope you found my analysis of this topic to be interesting. Thanks for watching.